එතකොට ඒ වගේම connective tissue, muscles, එතකොට ඒ වගේම blood, ඒ වගේම blood system, එතකොට ඒ වගේ. ඒවා sarcomas. ඒ origin වෙන ඒවා. ඒතකොට sarcos mean the fleshy නිකම් අර මස් මාංශමය ගතිය කියන මතක තියාගන්න. fleshy. එතකොට මේ this normal මේ introduction කියන්නේ for your knowledge. So this is very important to us. Mainly benign and malignant differences. What are the differences? Benign and the malignant tumors. It's also the very important to us. Feature එක ගත්තහම තියෙන boundaries නේද? දැන් boundaries කියලා වට ගත්තහම විශේෂයෙන්ම you have studied in your theory the benign tumors are encapsulated or well circumscribed නේද? හොඳට වට වෙලා තියෙනවා. අපි අර in picture also we observed නේද? The distinct the අර මාක් එකක් කියන එකේ හොඳට ඒක අල්ලන්නත් පුළුවන්. ඒ වගේ encapsulated round වෙලා ඒ වගේ තියෙනවා. And here the malignant poorly circumscribed and irregular because it's invade to the other tissues, so it is difficult to identify the margin නේද? ඒ වගේ. මේකේ නම් හොඳට margin එක well distinct ඒ වගේ තියෙනවා. ඒතර ඒක ඒ boundary. And also the regarding the air surrounding tissues, the benign often compressed තදවීම තියෙනවා, and also the do not invade nearby tissue. දැන් අනිත් ඒවට invert වෙන්නේ නැහැ. ඒවට spread වෙන්නේ නැහැ. Do not invade nearby tissues. Usually in malignant tumors, you know that they usually invaded. අනිත් එකට contact වෙවි යනවා, දිගට යනවා ඒව. Then the size, usually the small in benign and the malignant tumors often larger. So the secondary changes, what do you mean by the secondary changes? Neither sometimes the bleeding happens, sometimes the infections appear. ඒ වගේ එකයි මෙතන කියන්නේ. Secondary changes occur less often. තමයි නමුත් compared to the malignant is less often. අඩුයි ඒ වගේ. But in the malignancy it is more open. ඒ වගේ. Then the pattern ගත්තාට පස්සේ usually resembles the tissue of the origin clause. නේද? දැන් normal මේ original cell එකයි මේ tumor cell එකයි බැලුවොත් usually the resemble එක හා සමානයි. ඒ වගේ differences ගතියක් එච්චරම නෑ. ඒකයි කියන්නේ usually resembles the tissue of the origin clause. Here that the often poor resembles to tissue of the origin. එතකොට ඒ origin එකට හාත්පසින්ම අපි දැක්කා that the in definition ගත්තාම purposeless, autonomous සර ඒ වගේ තිබෙන ලක්ෂණ තියෙන නිසා poor resembles ඒ හා සමාන වෙන්නේ නැහැ ඒවා. Then the pleomorphism. It's also the very important word, medical word regarding the neoplasm. Pleomorphism කියලා කියන්නේ mean the marked variation in the shape of the individual cells. Marked variation. In the shapes of individual cells ගත්තම variation. එතකොට එහෙම variation usually in benign tumors වල එහෙම අඩුයි. ඒකයි කියන්නේ usually not present. එතකොට ඒ වගේ දැන් මේ වගේ මේකේ variation තියෙනවා. Here the open present in malignant tumors. ඒකයි pleomorphism. Then the mitosis. Mitosis, you know the type of cells division. The mitosis. The මේකෙදී may be present but are always typical mitosis. The same එකම වගේ තමයි may be present when one but are always typical mitosis. Here that the malignant tumors mitotic figures increase very rapidly the proliferation there අර කිව්වේ ඒ වගේ mitotic figures increase and are generally atypical and abnormal. Cells are different cell to cell the different aspects විදිහට තමයි තියෙන්නේ විවිධ විදිහට mitosis. එතකොට අර වගේ typical mitosis නෑ atypical. Those are the differences. Other further mentioned there. Then the function tissue එක ගත්තහම benign usually well maintained and malignant tumors may be retained lost or become abnormal විදිහට තමයි වැඩ කරන්නේ ඒ වගේ. Then the growth rate බැලුවොතින් benign usually slow growth rate compared to the malignant. Here the malignant usually the rapid නේද අපි කියවනේ rapidly very rapidly mitosis there ඒ වගේ ඉක්මනට හැදි යනවා ඒ වගේ. Then the local invasion බැලුවොතින් ස්පේතන often compresses නේද ඒ දැන් ඒ ස්ථානයේ අවට neighboring tissues වලට open compresses there. The surrounding tissues without invading or infiltration. There are no any infiltration. අනිත් cells වලට අනිත් tissues වලට no invasion. That's why the well circumference අර කියලා කියන්නේ හොඳ රවුමට තියෙනවා. ඒ වගේම can move වෙන්නත් පුළුවන්. ඒ වගේ අර අනිත් එකට නෑ. මේ can movable නේ. I will show you movable. ඒකට ඒ කියන්නේ අනිත් tissue එකට no invading there, no infiltration there. So that can move. Can be moved. Then the malignant tumors usually infiltrate and invade the adjacent, mean the nearby tissues. Invade වෙනවා infiltrate වෙනවා Then the metastasis absent in benign tumors and the malignant tumors frequently present. Compared to the prognosis බැලුවොතින් local complication there. Why the local complication? This is a compression there. So that's why that neighboring tissues, the compression there. The compression there නිසා අපිට මතකයි නේද some atrophy also can happen in the pressure atrophy. You have studied under the atrophy the topic. So ඒ වගේ local complications there. Here, the prognosis death by local and metastatic complication. Death වෙන්න පුළුවන් ඒ වගේ prognosis. It's not good. So, those are the differences between benign and malignant tumors. It is important to us. So, this is, I have given one example here for the lipoma. The lipoma, it's a benign tumor, lipoma. You can see here, common benign tumor, well differentiated. So, that's a name, the pathological name mentioned, the well differentiated. Mean, it's similar to the normal tissue එකකට සමානයි. ඒකයි අර දක්වලා තියෙන well differentiated. So lipomas are form of soft tissue tumor and consist fat cell. The fat cells තමයි මේ තියෙන්නේ. I have given the example. Can appear at any age, but often 40 to 60 years. I think for example, for your knowledge, I put here, most lipomas are small, painless, rubbery. නෙබෙන රබර් එකක් වගේ ඒ වගේ බෝලයක් වගේ rubbery, soft to touch. Actually some patients also come in such type of disease condition to our OPD and they are coming and what asking like, well, I think you have seen soft to touch and movable. Narawan කිව්වේ the movable because it is well circumference මේ හොඳට වට වෙලා තියෙනවා හොඳට encapsulated වට වෙලා තියෙනවා. It's no invasion, no infiltration to the other tissues. That's why the movable කියලා කියන්නේ movable. They often appear on the back, near the පිට ඒතකොට shoulders, arm, buttocks and the top of the legs නේ කකුල් උඩ පාදයේ උඩ ඒ වගේ ඇති වෙන්න පුළුවන්. This is the example for the benign tumors I mentioned here. Example. So today we discuss under the neoplasm can't discuss more and more. So I only one I have taken here the malignant colorectal tumors. Malignant colorectal tumor. tumors. ඉතින් මතක තියාගන්න ඕනේ colon, rectum මේ ඔක්කොම නේද? large intestine involved වෙලා තියෙනවා. So malignant colorectal tumors ගැන we today discuss. So, come to the introduction. Colorectal carcinoma. Colorectal carcinoma. Colorectal cancer comprises the 98% of all malignant tumors of the large intestine. So the important to us for our knowledge. It is the most commonest form of visceral cancer. It is the most commonest form of the visceral. What do you mean by the visceral? Visceral කියලා කියන්නේ නේද? The inside the මොනහරි ඒ වගේ අර දැන් කුහරයක්. The organ within a body cavity. නේ? දැන් visceral. එතකොට abdomen එක. ඒ වගේම උරස කුහරය තුළ ඒ උදර ඒ උරසෙට ඒ වගේ body cavity. The organ within the body cavity. The visceral cancer. Next, only to the lung cancer. So according to the US United States data, that's mentioned. So, the incidence of carcinoma of the large intestine rises with age. With aging. ඒක මතක තියාගන්න incidence දැන් මේවා statistically evidences දක්වලා තියෙනවා. ඒකයි මේ දක්වලා. The incidence of carcinoma of the large intestine rise with the age. Age එක තමයි ඒක. Average age of the patient is about 60 years. එතකොට about 60 ඒ වගේ ඉඳන් තමයි මේ හුඟක් වෙලාවට prevalence දක්වලා තියෙන්නේ. So, cancer in the rectum is more common in males than female in the ratio. Considering the ratio balloting, more common in males than female, especially the cancer in the rectum. Rectal cancers more common in males, 2 to 1. Ratio, male, female. But at the other location, in the large bowel, the overall incidence is equal for both sex. එතකොට අනිත් areas වල අනිත් ඔය ascending ඒ වගේම descending ඒ වගේම transverse අද ඒව බැලුවොත් ඒව it's normally equal. මේ වගේ එකක් නෑ. ඒක Come to the etiology, it's also important to ask etiological factors. And make it etiological, usually in the carcinoma, etiological factors, anyhow, in authentic text mentioned, etiology of the colorectal carcinoma is not clear, but a few etiological factors have been implicated. Few etiological factors. Number one is geographical variation. භූගෝලීය සාධක නේද? Geographical variation. The මේකෙදි දක්වලා තිනවා shows wide variation throughout the world. ඉතින් ගත්තහම statistical data reveal it is much more common in North America. ඒ වගේම Northern Europe. Then in South America, Africa and Asia. So, මේ countries වල ඒ වගේ more common. ඒ වගේම colorectal cancer is generally thought to be a disease of affluent society. What do you mean by the affluent society? නිකන් අර ධනවත් කියන එක නේද? affluent society. Because its incidence is directly correlated with the socio-economic status of the country. එතකොට මේ disease condition is directly correlated with the socio-economic status. Then usually under the case history still I remember I have many times mentioned to you also, because the socio-economic status is the very important sometimes, because under the personal information we are asking from the patient, because some disease correlate with the it is very much correlated with the socio-economic status. Like in our country also some our survey researchers reveal some correlation, socio-economic correlation with the low socio-economic status correlate with the some disorders. High socio-economic status and with correlate some disorders. As an example, then high socio-economic status correlate with the obesity. heart diseases. එතකොට ඒ වගේ දේවල්. එතකොට low socio-economic status correlate with the anxiety, එතකොට stress, ඒ වගේම hypertension, එන්නේ ඒ වගේ. ඒක හරියට ලස්සනට මේ correlate වෙන statistically. ඒකයි මෙතන මේ දක්වලා තියෙන්නේ. It's very much correlate with the දැන් අර මේ ධනවත් රටවල් මේ විශේෂම socio-economic status එක මේක හොඳට මේ colorectal මේ cancer prevalence එක correlate වෙනවා කියන එක තමයි මෙතන ඒ දක්වලා තියෙන්නේ. ඒකයි අපි කියන්නේ for the survey data socio-economic status is very important because we new අදහස් අර ඒ වගේ ideas will reveal. So and also the dietary factors so means diet play a significant part in the causation of the colorectal cancers. diet එක හරියට එතන බලපෑම දක්වලා තියෙනවා. දැන් a low intake of vegetable low intake vegetable fibers තියෙන අඩු intake වුණාම diet lead into low stool bulk. Stool අපි දන්නවා අපි stool examine also we mention stool bulk එක අඩු වෙනවා with the low vegetable fibers diet එකේ. ඒ වගේ bulk is associated with high risk of colorectal cancers. High risk of colorectal cancers එක associate වෙනවා විශේෂයෙන්ම මේ low intake of vegetable fiber. ඒක මතක. දැන් තව example එකයි especially දැන් ඔය dietary habits ගැන බැලුවොතින් especially in the දැන් ඔය China එතකොට ඊට පස්සේ ජපාන් වල දැන් ජපාන් වල ගත්තාම දැන් ඒගොල්ලෝ දර hot ඊටාම උණුසුම තමයි නිකන් ආහාර ගන්න. So they among Japanese people that esophageal cancers are more. ඒ වගේ දැන් මේ dietary factors also affect to this disorder. ඒකත් මතක තියාගන්නට ඕනේ. So and also consumption of large amount of the fatty food. නේද? Fat amount very diet by population results in excessive cholesterol and their metabolite. Cholesterol metabolism නිසා which may be carcinogenic. ඒ වගේම consumption of large amount of fatty food එහෙම ඉන්න පුළුවන්. ඒකයි ඒ දක්වලා තියෙන්නේ for their metabolite. ඒ වගේම excessive consumption of refined carbohydrates. වැඩිපුර carbohydrate, refined carbohydrate that remain in contact with the colonic mucosa for prolonged duration. So then excessive consumption contact with the colonic mucosa for prolonged duration changes the bacterial flora of the bowel, thus resulting in production of the carcinogenic substance. Due to that reason also affect to this colorectal cancer as etiological factor. Excessive consumption of refined carbohydrates. And also familial factor and family tendency. It also the local role, a major role family especially for the cancer සම්බන්ධයෙන්. Carcinomas of colon and rectum have some familial tendency that could be genetically determined. Family tendency. Still I have remember one case. For your knowledge, I am here. The 10 years back in our department, the Kayachikitsa, that had one few supportive staff that he also retired now. So his wife died due to the thyroid carcinoma. The thing is that poor innocent lady did not did not go to the any hospital. She is very much afraid, so didn't go any place to check or anything. So that's why she died. So in her family, elder brother and also the mother also died due to cancer. So that's why family tendency also very much give to this as a positive factor for the cancer. ඒකත් අපිට මතක තියාගන්නට ඕනේ. So other diseases, some diseases also mentioned. Presence of certain pre-existing diseases. ඉස්සරලා හැදිලා තියෙන ඒ රෝග තත්ත්ව බැලුවකින්. As an example given here, colorectal polyps on neoplastic colorectal polyps. Polyps, I will show you. ඒ වගේම inflammatory bowel disease. What are the inflammatory bowel? Then ulcerative colitis, Crohn's disease. These are the chronic bowel diseases, especially in the large intestine. ඒ වගේ inflammatory bowel disease. ඒ වගේම diverticular disease. Anthravollar pouch activity. I will show. ඒ වගේම role of tobacco smoke. දුම්බීම. Development of colorectal cancer in young patients. Therefore, long duration increase the risk of developing colorectal cancers subsequently due to this condition. Here you can see that the colon polyps, polyps විදිහට මේ තියෙන්නේ. ඒ වගේ I have given here the polyps මේ flat it was sessile මේව නිකන් just can see you polyps with stalk මේ නැට්ටක් වගේ එකක් තියෙනවා colon polyps here the colon polyps so එතකොට these are the risk factors for the colorectal carcinoma. And also the diverticular. නේද අර කිව්වේ divert නේ pouch මේ මල්ලක් වගේ තියෙන ඒ වගේ නේ diverticular මේ අහලා ඇති දේශනවල උගන්වන්නත් ඇති diverticular disorders. So here the colonic diverticular. So this is the ulcerative colitis. Ulcers appeared. So this is the normal colon. Can compare ulcerative colitis. So here also the ulcerative colitis is the gross pathology. Here the mention here the segment colon, this segment showing extensive congestion තත්ත්වයක් තියෙනවා and hemorrhage we can see here hemorrhage irregular ulceration නේද regular නෑ irregular මේ තියෙන හැම පැත්තටම තියෙන irregular ulceration with pseudopolyp. What do you mean by the pseudopolyp? It's not the true polyps polyps මේ pseudo නිකන් අර මේ වගේ polyps ආකාරයට can see everywhere මේ තියෙන්නේ ඒ වගේ with pseudopolyps formation and minimal wall thickening colon wall also the thickening here this feature because continuous ulceration මොකද දැන් හැදෙනවා හොඳ වෙනවා again නේද හැදෙනවා ඒ වගේ continuous ulceration that's why this appearance happening. So anyhow is the gross pathology of the ulcerative colitis මේ බලන්න අර අපි කිව්වේ මේ bleeding තියනවා නේද ඒ වගේ එහෙම එනවනේ ඒකයි right. Now we reach to the pathological changes. It is important to us colorectal carcinoma pathological changes. See here බලමු distribution of the primary colorectal cancer really reveals that about 60% of the cases occur in the rectum. Majority නේද 60% of the cases belongs to the may occur in the rectum area even. Followed in descending order by the sigmoid and the descending colon 25%. මේ තියෙන්නේ 25%. The cecum and ileocecal valves is 10%. Then the ascendant colon and the hepatic and the splenic fractures 5%. And quite uncommonly in the transverse colon. And those are the places කොහොමද දක්වලා තියෙනවා distribution of the primary colorectal cancer percentage wise. දැන් මේකෙත් පෙන්නුම් කරනවා distribution of the primary colorectal cancer. අර අපි කිව්වා වගේ නේද? rectum some text mention the 70%. ඉතින් මේවා එක 60 තියෙනවා anyhow. එතකොට majority rectum. Others the අපි කිව්වේ transverse colon rare and the others area sigmoid and sigmoid මේ තියෙන්නේ sigmoid එතකොට descending colon ඒවයි 25% and the ascending colon hepatic ඒවයි ඔක්කොම lecture ඒවයි මේවයි 5% cecum and ileocecal valve ඒවයි 10%. Those are the distribution of the primary colorectal cancer. So macroscopically balloting macroscopically නැත්නම් gross appearance there are distinct differences between the growth on the right and left half of the colon. It is very important. There are distinct differences. පැහැදිලියම පෙන්눔 කරනවා between the growth on the right and the left half of the colon. මේ දෙක බැලුවොතින් මේ පැහැදිලි වෙනසක් පෙන්눔 කරනවා. ඒකයි මෙතන කියන්නේ. The right sided growth එක බැලුවොතින් tend to be large. Cauliflower. What do you mean by the cauliflower? නේද අර නිකන් polyps ආකාරයට නිකන් අර මලක් වගේ cauliflower like soft and friable masses. Friable කියලා කියන්නේ මොකද? කැඩි යනවා friable mass. Projecting into the lumen. මේ නෙරලා තියෙනවා මේ colon එකේ lumen. නේද? Fungating polypoid carcinoma. කියන්නේ fungating polypoid carcinoma කියලා කියනවා. This is the macroscopical appearance එක ඔන්න කියන හැටි. ඒ වගේම ඒක තමයි මේ දක්වලා තියෙන්නේ. Between right side and the left side එක මේ තියෙන්නේ. Right side and the left side. Then right side අපි කිව්වා නේද fungating polypoid carcinoma. මේ තියෙන්නේ ගෝවා මලක් වගේ. ඒ වගේ macroscopic appearance of colorectal carcinoma. A right sided growth මේ තියෙන්නේ right sided growth. Fungating polypoid carcinoma මේ තියෙන්නේ fungating that means the inside here the inside see fungating polypoid carcinoma. ඊළඟට showing ඊට පස්සේ ඊළඟ එක තමයි B මේ තියෙන්නේ ඒක left side growth එක බැලුවොතින් left sided growth napkin ring configuration. මොකද මේ napkin ring configuration කියලා කියන්නේ. දැන් ring එක කියලා කියන්නේ මුද්දක් වගේනේ. ඒතර මේක napkin එකක් අර napkin එකක් ring ගෙවුවොත් කොහොමද මේ මුද්දක් අස්සට ring එක napkin ring configuration මේ තියෙන්නේ. අන්න ඒතර ඒ විදිහ තමයි මේ තියෙන්නේ ඒකේ spread of the growth into the bowel wall මේ තියෙන්නේ spread growth එක bowel wall. ඒතර මෙතන narrow වෙලා තියෙනවා අපිට පෙන්වුම් කරනවා. napkin ring configuration ඒ විදිහට හා සමාන වෙනවා. මේ side එක තියෙන්නේ fungating polypoid carcinoma. ඒක තමයි කියන්නේ different distinct features තියෙනවා මේ දෙපැත්තේ දෙකේ. ඒක තමයි මේකේ තියෙන එක. ඔන්න දැන් මේ වගේ මේ තියෙන්නේ right this is the right side the fungating polypoid carcinoma මේ තියෙන්නේ ඒ වගේ this is the napkin ring configuration. දැන් අර ඒ වගේ ring එකක් අස්සට මේ වගේ රෙදි කෑල්ල වගේ napkin එකක් මේ දැන් මෙහෙම තමයි තියෙන්නේ නේද? මෙතන narrow වෙලා මෙහෙම තියෙන්නේ අභ්‍යන්තර. දැන් මෙතනත් you can see very well in the gross appearance left side growth එක. දැන් මේ බලා ගන්න මේ තියෙන arrow එක arrow also here see the growth here the how much narrowing that the inside the lumen මේ normal places මෙතන තමයි තියෙන්නේ. Here that the fungating polypoid carcinoma මේ තියෙන්නේ ඒ වගේ right sided growth මේ right side මේ left side අන්න ඒකයි මෙතන කියන්නේ. ඒක අපිට වැදගත්. This I bought from the website එකෙන් ගත්තේ. ඒතර ඒකෙදිත් මේ කියලා තියෙන එකේ 70% දක්වලා තියෙන rectum එකේ තමයි කියලා. අපිට අර 60% තිබුණා සමහර තැන් වෙනස්. So the left sided carcinoma මේ තියෙන්නේ left sided. Yeah left sided carcinoma. The right sided polypoid fungating masses obstruction is uncommon. Here's obstruction තදටම තියෙනවා නේද? earlyම obstruct වෙලා තියෙනවා මේ left side. So this is the morphological appearance. How බැලුවොතින් growth in the left colon on the other hand have napkin ring configuration. Example, they encircle the bowel wall circumferentially with increased fibrous tissues forming annular ring. නේද? එහෙම round ring එකක් වගේ. Actually we have good in a specimen also in our institute. It's a good specimen there. මේ විදියටම තියෙනවා. Fibrous tissues growth වල macroscopically can see. අපි නමුත් අපි මේකේ දැක්ක හොඳට and have central ulceration. මැද ulceration we observed on the surface with slightly elevated margin. Carcinomatous ulcer. These differences in right and left colonic growths are probably due to the liquid nature of the content in the ascending colon, leaving space for the luminal growth. Due to the content of the ascending, descending, compared to the ascending, descending your balance, contents අනුබද කියලා එක තමයි මෙතන කියන්නේ. නිසා luminal growth on the right side, while the contents in the left colon are more solid, permitting the spread of growth into the bowel wall. ඒකේ ගොඩාක් bowel wall එක එතන තදවීම ඒ වගේම solid ඒ වගේම narrow වීම තියෙනවා compared to the right. However, early lesion in the left as well as the right colon are small button-like areas of elevation. Early stage එක බැලුවොතින් button-like පුංචි බොත්තම් වගේ තමයි තියෙනවා කියලා දක්වලා තියෙන්නේ. ඒක අපිට detail ඕනේ. Right and the left we can identify the changes. And microscopically, the appearance of the right and the left-sided growth is similar. Growth is similar. But 95% of the colorectal carcinoma are adenocarcinoma of varying grades of the differentiation. The well differentiated. ඒ වගේ දැන් ඒ වගේ poor differentiate ඒ වගේ දැන් මේකේ මේ අනුව එකයි දක්වලා තියෙන්නේ 95% colorectal carcinoma are adenocarcinomas of varying grades of the differentiation. විවිධාකාර විදියට differentiation තමයි macroscopical and the microscopical features. Now we move to the spread. කොහොමද පැතිරීම Carcinoma of the large intestine may spread by the following routes. දක්වලා තියෙනවා. I think in lectures also you have studied the spread of the කොහොමද මේ neoplasm මේවා spread වෙන්නේ ඒවත් ඉගෙනගෙන තියෙනවා. ඒත් හා සමාන තමයි. is similar. Direct spread නේ ඒ වගේ direct කෙලින්ම organ to organ ඒ වගේ. The tumor spreads most commonly by direct extension in both ways. Circumferentially into the bowel wall as well as directly into the depth of the bowel wall. So ඒකේ වටේට ඒ වගේම depth of the bowel wall. ඒකේ ගැඹුරට ඒ අනුව to the serosa. Pericolic sac and sometimes in the peritoneal cavity. Say peritoneal cavity දක්වාම එතකොට directly can spread ඒ වගේ. So, it was lymphatic spread also mentioned. Spread via lymphatic. A lot of lymph circulation here because of the intestine. They ashritawa spread via lymphatics occur rather rarely and involved. Firstly, the regional lymph nodes in the vicinity of the tumor. Regional lymph nodes, you understood that. And then into the other groups of the lymph nodes. Regional ඒවට ගිහිල්ලා ඊට පස්සේ අනිත් ඒවාට යනවා. Like pre-aortic, internal iliac and the sacral lymph node ඒවට යනවා. Lymphatic spread. අපිට lymphatic spread කියලා මතක තියාගත්තත් ඇති ඈ. Now hematogenous නේද? Through blood hematogenous. Blood spread of large bowel cancer occurs relatively late. පස්සේ තමයි වෙන්නේ. And involves the liver, lungs, brain, bones and ovaries. නේ ඊළඟට ඒවට through hematogenous spread මතක තියා hematogenous ඔය තමයි how it's spread. Now come to the clinical features. Clinical features mentioned. Clinical symptoms in colorectal cancer appear after considerable time. After long term. ඊට පස්සේ තමයි හුඟක් වෙලාවට දකින්න හම්බ වෙන්නේ. Considerable time. සැලකිය යුතු කාලයක් යන. ඒතර කිව්වම occult bleeding නේද? occult bleeding. සැඟවුණු රුධිරය තියෙන්න පුළුවන්. occult bleeding. melena කියලා කියන්නේ. melena. Change in bowel habits. What do you mean by the change in bowel? Sometimes the constipation, sometimes diarrhea, changing in bowel habits. More often in left-sided growth. Left side එකේ තමයි මේ more often. ඒ වගේ. Loss of weight mean the cachexia. That word you know, cachexia, severely weight loss. Loss of appetite, you know, anorexia, and also the other anemia, weakness, malaise, lethargy also there. So, due to this condition. Those are the clinical features. Complication also mentions complication, especially the obstruction. Intestinal obstruction and the hemorrhage. Hemorrhage due to the bleeding, hemorrhage are the most common. Most common. ඒ වගේම perforation. අන්ත්‍ර සිදුරු වීම perforation. After that the peritonitis happen, so sudden death can appear. ඒ වගේ වෙන්නත් පුළුවන්. Then the secondary infection. Those are the complications of the colorectal carcinoma. Now we reach to the diagnostic methods. Usually the stool test for occult blood. අපි දන්නවා එක stool test for occult blood. එතකොට rectal examination, ඒ වගේම proctoscopy, ඒ වගේම radiographic contrast studies. දැන් ඔය barium meal follow through x-ray ඒ වගේ දේවල් ඒව නම් දැන් ගොඩාක් කරන්නේ. but the CT scan can identify නේද? එතකොට ඒ වගේ ඒවා තමයි diagnostic methods. Come to the prognosis. Prognosis depends upon a few variables. ඒකේ දක්වලා තියෙනවා variables දක්වලා තියෙනවා. ඒක මත තමයි based on depend the prognosis extent of the bowel involvement. extent එකේ කොච්චර දක්වාද bowel involvement. ඒ වගේම presence or absence of the metastasis. නේද? දැන් brain, liver, kidney ඒ අනෝයි කිව්වනේ. එතකොට that places also happening. The presence of absence of metastasis. Histology grading of the tumor. ඒක නම් theory ගන්නවා දන්නේ නැහැ කට්ටියට. histology grading of the tumor. ඊට පස්සේ location of the tumor ඒ තියෙන ඒ තැන අනුව. ඒ වගේ location of the tumor. ඒ වගේ. එතකොට ඔය තමයි prognosis. ඒතර මේක I am putting here grading කරා ගන්න මේක දක්වලා තියෙනවා Duke's ABC classification of the colorectal carcinoma stage 1 දැන් එහෙමනේ මුගක් වෙලාට නේද මේ stage එකේ then the stage B stage C එතකොට ඒ අනුව මේ tumor confined to the submucosa and muscularis එතකොට ඒ ටිකට stage B tumor penetrates into the adjoining tissues මේ තියෙන්නේ ඒ වගේ stage B ඊට පස්සේ stage C presence of the lymph node involvement නේ ඒ අනුව according to the grading here අපිට එච්චර මම හිතන්නේ theory නම් කරාද දන්නේ නැහැ ඔයාලට in details මට අපිට ඕනේ for your knowledge put here ඒවා අපිට ඕනේ මොකද reference කරනවා sometimes some patients නේද ඒ වගේම අපිට some investigation reports that they are taking patients ඒවත් අරන් එනවා so that's why it is we need that knowledge. This also mentioned the bleeding areas, gastrointestinal bleeding, not the colorectal. This is for your knowledge giving here. Make එක බලා ගන්න. බස් එක ඒවා තියෙනවා මේ bleeding. Here that the mention the tumors of the ava transverse colon ඒකත් අපිට ඉතර අපි නම් we discussed මේකත් ඒව බලා ගන්න anastomosis left descending colon dissected ඒවා here the small colon carcinoma small colon carcinoma. Carcinoma growth. Here the adenocarcinoma of the rectum. අපි කියන්නේ the 95% the adenocarcinoma, the colorectal carcinomas. ඒ වගේ. And identify here cross appearance. This is also adenocarcinoma of the sigmoid colon. You see the bleeding, hemorrhages, adenocarcinoma also. How is the narrow of the colon? Can identify. මේකෙදි treatment ගැන මෙතන management එක ගැන කියලා තියෙන්නේ ඒක for your knowledge. Okay. The colon carcinoma here. Colon carcinoma. Majority carcinoma obstruct the passage, the narrow colon cancer. The colon cancer. Colon cancer and the polyps එකත් බයිට් ලස්සන නැහැ. ඒ වගේ දක්වලා තියෙනවා here. Colon cancer and the polyps here. ඒ වගේ. So it's difficult to identify. නේද? මේක ලස්සනට පෙන්වන්න කරන්නේ ඒක enlarge කරාම colon cancer. Anyhow you identify it well. Now how is the causative factors, how is the distinct features ඒවා. ඒ වගේ familial adenomatous polyposis. Adenomatous polyposis. Right? Endoscopic appearance of sigmoid carcinoma. Section to be removed during the surgery. Surgery මේගොල්ලෝ කරනවා remove කරලා surgical treatment කරනවා නේ මේවට ඒ වගේ ඒවා sigmoid colon carcinoma එක නම් දැක්ක ගමන් identify කරා ගන්නත් colon cancer earlier also that picture here. Okay, sigmoid colon cancer and the polyps. Ulcerative colitis, you know that the diverticulous, you know, right? Here the sigmoidoscope. There කොහොමද වෛද්‍යවරයා මේ sigmoidoscopic ඒ කරන්නේ ඊට පස්සේ මෙහෙම දාලා බලා ගන්න පුළුවන් sigmoidoscope. Sigmoid colon දක්වා යනවනේ sigmoidoscope. Especially for the diagnosis. ඔය ටික තමයි අපිට තියෙන්නේ regarding neoplasia. We studies what are the differences between the benign and the malignant tumors, and especially we gave the examples the colorectal carcinoma, what are the causative factors and the distinct features, macroscopic, microscopic, eticapi, Enang hari student today any queries regarding this lesson? Enang අපි ගොඩාක් ඉවර කරගෙන ගිහින් තියෙන්නේ නේද? මේ හුඟක් classes මේ හුඟක් දැන් අපි මම හිතන්නේ this is the 13 නේද? 13 lesson 13ක්ම කෙරුණා. I think Manoma madam also කරන්න ඇති සෑහෙන්න. එතකොට අපි දැන් ගොඩක් කෙරිලා තියෙනවා. තව කීපයක් දෙකක් කරොත් ඇති කියලායි මට හිතෙන්නේ. Okay student, what are the queries and මොනවද තියෙන ප්‍රශ්න? Yes. Ellen, thank you so much. I will put to this LMS tomorrow. Nang amaru class එකක් කරන්න. Tomorrow I need to go to the college and hospital duties also there. So that's why. Okay, student. Thank you. Thank you for joining to the class. Good night. Subject करना है.
Thank you, madam.
Thank you, madam. Okay.
Good night, madam.
Good night. Okay. Aman. Lipoma. What do for lipoma? I have given for the as example for the benign tumors. Okay. Okay. Okay.